Joining me now from Atlanta is a person who knows a lot about a team of geeks, because he used to be one of them. Clay Johnson is the CEO of the Department of Better Technology and author of The Information Diet, also a former Presidential Innovation Fellow, the same group that the administration is now bringing in to help troubleshoot healthcare.gov. So nice to have you today, Clay.
Thanks for having me.
So just in the simplest terms that even nerds can understand, even though we're not geeks, what is wrong with the site?
Well, it's an interesting question. A lot has gone wrong with the site. The first thing that's wrong with it is clearly the people who made it aren't very good at at programming. You know, any programmer, if you've ever opened a web browser, sometimes if you just sort of explore the menus, there's this menu item called View Source, and you can click on that and actually see some of the code that's running inside of healthcare.gov or any website that you go to. And any developer that's looked inside of the source of at least the front end of healthcare.gov has really, I don't know a better word than facepalm. Like they've really just. But I mean, what's really gone wrong here is that we've lost our management brains for technology.
Yeah.
And so in 1996, maybe it was 95, the Republican Revolution came and gutted Congress's brains. It was called the Technology Assessment Office, and it was this team of people who advised Congress on how to implement technology and how to implement technology policy. And that's why, you know, for me as a technologist, when I was watching the hearings the other day and watching the contractors who are really not qualified to do this work and the members of Congress who are really not qualified to ask questions on technology,
right.
All I could think of was like, this is like my 1-year-old arguing with my cat.
Yeah, right. Right. I don't even want to know which one's the 1-year-old and which one is the cat. Right. But let me ask, because this point that you've just made, I think, you know, to the extent that there is some good that may come from all of this, it is in part sort of the American people starting to ask questions about how common this kind of contracting is, where you are saying to me, look, there are folks doing this work who simply are not qualified to do it. I can just look at how the code is running and immediately sort of notice, wait a minute, this is from, you know, 94 or some other ridiculous time period. How common is that as a part of the problem of how government projects in general happen?
These failures are the rule, not the exception. The Standings Group came out earlier this week, and did an analysis of all federal IT projects of greater than $10 million and found that 94% of them screwed up in some way, shape, or form, and about half of them failed outright. Generally, you know, federal IT projects done well are the exception, not the rule. These things always happen, whether it was healthcare.gov this year, last year it was the System for Award Management, or SAM.gov, that cost $181 million and failed. And it happens at the state and local level too. New York City had City Time. It was about a $500 million project that ended up with some indictments. The state of California has a docketing system that's $2 billion and years overdue.
And Clay, there was this one moment where it seemed like that wasn't what was going to be happening, and that is during the Obama 2008 and the Obama 2012 elections. Those campaigns seemed so nimble when it came to technology, not only the use of kind of social media and new technologies, but actually being very good at how they sent out, you know, how to get everyone to click that red button and give their $10. Is part of what's going on here people just being astonished that our kind of digital presidency has not been able to deliver?
That's the big problem, is that the same people, that same kind of technology can't really get into government because there's this procurement policy. It's about 1,800 pages of regulation that keeps small businesses from coming in and working on stuff like healthcare.gov. So the contracts are going to the people with the best lawyers, not the best programmers. Look, I was Howard Dean's lead programmer in 2004 for his presidential campaign, and I'm still waiting for that technology to make it into government. I'm still waiting for the companies that you know, built around that campaign to be able to work on government stuff, and they just can't because the barrier to entry is just too high, and it needs to change.
Clay, stay with us, because I want to keep talking about this, but also talk about why, as much as that's an argument, it's not an argument for why you shouldn't have Obamacare. So I want to talk about the website healthcare.gov, fixing that, and also what the real problems with ACA are. It's not what you think when we come back. Clay, let me come to you on this, because in this effort now and push to fix this, we're starting to learn about the contractors, one of whom, and this is, I think, maybe one of the most troubling things that I read this week, one of whom is owned by United Healthcare, which also owns one of the nation's largest insurers. It feels like we're going to get single payer, but not really single payer, but sort of, you know, one nation united under United Healthcare.
This is probably the biggest failure of this Congress and last week's hearings was no one asked about stuff like that, or like the fact that CGI Federal lobbied for the passage of the Affordable Care Act. Not one member of Congress asked, hey, CGI Federal, what were you doing lobbying on the passage of the Affordable Care Act before you even had the contract?
Yeah.
Nobody asked that.
And